Tony Fauci has been leading the federal government's fight against HIV/AIDS. Along the way, he has advised presidents, been condemned, but also then applauded by its activists for accelerating access to new AIDS drugs, and has become one of the world's most celebrated scientists in immunology and HIV/AIDS. For his vision and many accomplishments, Tony has received numerous awards for his scientific accomplishments, including the Presidential Medal of Freedom in 2008 and 22 honorary doctorate degrees from universities in the US and abroad. Now the Forum for Collaborative HIV Research, on behalf of the entire HIV community, is honoring Tony as the 2011 recipient of the C. Everett Koop HIV/AIDS Public Health Leadership Award. Named for former Surgeon General C. Everett Koop, this award is unique because it honors distinguished service, vision, and leadership in fighting HIV/AIDS, attributes that have made both Dr. Koop and Tony Fauci true legends in medical history. At the Forum's 2010 National Summit on HIV Diagnosis, Prevention, and Access to Care, Tony Fauci changed his entire schedule so he could present the first C. Everett Koop HIV/AIDS Public Health Leadership Award to Chick Koop himself. And almost 400 scientists, public health leaders, and advocates had tears in their eyes. A year later, Dr. Koop has driven 12 hours from his home in New Hampshire to present a second C. Everett Koop HIV/AIDS Public Health Leadership Award to his longtime friend and colleague, Tony Fauci. And another pioneer in the fight against HIV/AIDS, Congressman Henry Waxman, will also pay tribute to Tony for his contributions as a scientist, public health leader, and as a communicator of science. Congressman Waxman represents California's 30th Congressional District, which includes the cities of Santa Monica, Beverly Hills, West Hollywood, and neighboring areas of Los Angeles. But for those of us in the area of public health community, Congressman Waxman represents all of us and has since he first came to Congress in 1974. Now, as the ranking member of the House Energy and Commerce Committee and previously as the committee's chairman, Congressman Waxman continues to fight for universal health insurance, comprehensive Medicare and Medicaid coverage, and women's health research and reproductive rights, among other health priorities. Most significantly for the HIV/AIDS community, Henry Waxman has been one of the most ardent champions of government funding for AIDS, research, and federal investments into HIV/AIDS prevention, early detection, and access to quality care. Congressman Waxman witnessed the beginning of the AIDS epidemic and quickly responded by convening the first of over 30 hearings in the Health and Environment Subcommittee in 1982 to raise public awareness and secure initial government funding for AIDS research. Since then, he has written and helped enact federal legislation to fund the search for a cure and bring meaningful relief to people with HIV/AIDS. Over these 30 years, Congressman Waxman formed a personal bond with Tony Fauci and continues to seek Tony's advice and counsel. Thus, there is no one better in the Congress to speak about Tony's contributions to advancing public policy on HIV/AIDS over the last 3 decades. So please join me in welcoming Henry Waxman.
Thank you very much for that nice introduction, and I'm pleased to be here with two of my heroes, two men who are legendary in their leadership in fighting for reasonable and important and essential care for people with HIV/AIDS. In your video, which I gather has not been yet shown,
No.
I had my
You came too early.
I had my chance to praise Tony Fauci and his work on HIV. He's a great leader in research and policy, and you know, and we'll hear more of about his great work, and so I'm pleased to be here to honor him. But I get the double pleasure of being able to honor another great leader, Dr. C. Everett Koop. Surgeon General Koop has had a once-in-an-era career. He helped make the nation face the consequences of tobacco use. He provided some of the first guidance of the health effects of obesity. As Surgeon General, he led the way on injury prevention in children. But the work that brings us here today, and that will be a chapter in public health history, is his work on HIV and AIDS. It would be hard for anybody under the age of 40 to imagine the circumstances under which Dr. Koop and Dr. Fauci were working on AIDS in the early 1980s. The public was sometimes complacent and sometimes panicked. Politicians were sometimes negligent and sometimes hysterical. And the Reagan White House, including the president himself, was silent. But as Surgeon General, Dr. Koop became the person that everyone trusted. He spoke calmly and clearly. He faced down politics, and he served as the nation's physician. During that time, he helped create urgency without panic and hysteria. He helped bring humane care to people with HIV/AIDS, and he started us on the path of distributing information and prevention rather than blame and discrimination. It has been one of the great pleasures and honors of my career to work with Chick Koop, and I would like to introduce him to you so that he can honor with all of us Tony Fauci.
So thank you. So we will now go ahead and show the tribute video. Yeah. So we will do the tribute video now, so hopefully you can still stay and see that. So David, if we can have that up and running, we may have to turn around to see it.
Ronald Reagan is sworn in as the 40th American.
I'm now delighted to introduce the 13th Surgeon General of the United States, Dr. C. Everett Koop, who, as I said before, drove all the way from New Hampshire to be here today. In 1981, when Dr. Koop assumed the job of Surgeon General, he was considered one of the world's foremost pediatric surgeons. As Surgeon-in-Chief at Children's Hospital of Philadelphia, he established the country's first surgical infant intensive care unit and pioneered cancer treatments for children. Once in office as Surgeon General, Dr. Koop's tenure was truly historic. Placing good medicine above politics, he took on the issues that others found too controversial to confront: smoking cessation, obesity, and HIV/AIDS. Tough-minded, frank, and always believable, Dr. Koop invigorated the role of the Surgeon General as the nation's doctor. And for his courage and extraordinary leadership, he has received numerous awards, including the Presidential Medal of Freedom and the Public Health Distinguished Service Medal. In a few weeks, Dr. Koop is turning 95 years young, and he's making every day count. Since stepping down as Surgeon General in 1989, Dr. Koop continues to speak out on the issues through his writings and a senior scholar of the C. Everett Koop Institute at Dartmouth. We couldn't be more thrilled than to turn the podium over to Dr. Koop to present the 2011 C. Everett Koop HIV/AIDS Public Health Leadership Award to his longtime friend and colleague, Tony Fauci.
It may sound like a put-up job, but it isn't. He gave it to me last year, I give it to him this year. I hate to start off with an apology, but I am sitting before you not quite the almost whole man I was the last time we met a year ago. And I regret that even more than you do. I am much deafer than I was then, but I am essentially blind. And those two things really tend to isolate you from society, and especially for someone such as I, who gets most of his information from the printed word. It's a very difficult handicap indeed. And in spite of my age, 95 next month, I have to tell you that people frequently say to me and Cora, my wife, how did you two meet? And I expect that because that's what they ask new brides and grooms and so forth. But the thing I never expected would they say, how did you and Tony Fauci meet? And I got thinking about that, and I don't remember that Tony and I ever mentioned this on the same pulpit at the same time, but when I came to Washington, I was too old to be Surgeon General under the then prevailing public health laws, and so I was named deputy something or other, and it gave me a title and it gave me apparently some power, because very shortly after that, there was a big fracas in Spain over salad oil and olive oil. Somebody had mixed the two, and they were having a great time making money on the better. And so I was dispatched to Spain. I knew nothing about salad oil. I knew nothing about olive oil. I knew nothing about Spain. I knew nothing. And I got there, and the first person I discussed the situation with was a truck driver of one of the trucks that had been stopped and found to have the wrong kind of oil for his manifesto. And I just started to have a conversation with him, and he says, you know, there's another guy from Washington here too, asking the same questions you are. And I said, who, where is he? He says, that little fellow over there. And I walked over, and it was Tony. And Tony, I never asked Tony how much he knew about those three things, but he can tell you that later if he'd like. But anyway, I did find out that NIH was in on this for some reason, and Tony was their choice to go over and get the Spanish straightened out about olive oil and salad oil. So that's how Tony and I met, for those who are interested, and it was a very victorious time as far as I'm concerned. The Spanish were happy with whatever we did. There was no aftermath that came around, as it does sometimes, to haunt you because of your lack of knowledge of what you were doing. And I came home with a new friend, with a new personal physician, and with the Spanish people apparently happy with their oil situation, and Tony and I became closer friends as time went on. The best day I ever spent with Tony had nothing much to do with medicine, but I hired a limousine in Brooklyn, and I took Tony and his father and my first wife and I on a tour of Brooklyn. And the itinerary brings tears to a Brooklynite's eyes. We went to the school where Tony started out. We went to the school where I started out. We went to Prospect Park, where we both played cops and robbers. And we went to Coney Island and had a Nathan's hot dog, which we both were raised on. And we had a very fine time. And I still think of Brooklyn in terms of that remarkable journey that we took together. And Tony and I have had frequent Brooklyn crossings at a situation such as the one we are enjoying today. Tony went on to become the chief of allergy and infectious disease at NIH, and he has risen to a kind of fame that probably the people here in this room don't even know. But there was a phraseology used when I was a kid, and it said, so-and-so is the last word at so-and-so. What that meant was if you worked for Funk and Wagnall, the dictionary publishers, and you wanted to say that somebody was really the guy that pulled the strings at Funk and Wagnall, you said, he is the last word at Funk and Wagnall. And Tony is kind of the last word in medicine. Now, I want to make that clear. Let's say that the scenario is 4 or 5 doctors talking over what they like to talk over most, a tough problem that they have in clinical medicine that they haven't really figured out. And when I say that Tony now is the last word, you'll understand what I mean when somebody in the group says, "Have you asked Tony?" Because if you haven't asked Tony, you haven't asked the top. And if you have asked it, you got the right answer. So it's been great to tail along on Tony's coattails here in our joint enterprise of taking care of the poor and needy, as well as those with AIDS. And I have always considered Tony to be the last word, and especially fortunate, I thought, to have him as my personal physician. And the success that Tony has had is really available to other people if they would only have the same characteristics that Tony does. That is, if they had his character, his work ethic, his devotion to constantly contributing to the health of mankind, and it is done through, in his case, research on health, and that's why he has so much acclaim that follows him around. Tony is a seeker after knowledge. And now I could tell you, and I think you'd believe it after last year and today, that Tony is a perfectionist. He's a perfectionist in everything he does. I used to say when AIDS came along that AIDS was a disease that was made for a surgeon general. And then I used to say, and I'm a surgeon general for which it was made. Well, you could say the same thing with different titles for Tony, because Tony has been the last word in AIDS since he started, and he will continue to be as long as he perseveres with the same attitude that he has now toward the sick and the dying. Only I would say that Tony is far better example of being the man for AIDS at the right time. So I would tell you one final little story about Tony that I think everybody knows, and that is when we sent out the mailer, which was about this big, and we were trying to tell the public what AIDS looked like in a person, and that you couldn't look at a person and say, he has AIDS. And somehow or other, we got to that big question in the mailer, and it said, what does AIDS look like? And through some awful glitch, when the makeup page was put together, they put Tony's picture right under the question mark, what does AIDS look like? And the fact that Tony never talked to me about that, I think tells you what kind of a friend Tony has been. And he will continue to play this role, I think, as long as he has the stamina to keep going. And the public's health will be something that Tony puts first. And nothing comes before it. And he will be the one that is the recipient of this year's C. Everett Koop Award. And it gives me tremendous pleasure to be the person that is here at the presentation of that award. And Tony will, by the behavior he has already shown, go on to keep AIDS from being something worse than it is now and something far worse than it could be in the future. So I give you this year's recipient of the C. Everett Koop Award, Tony Fauci.